Okay. Hello everyone, Dr. Rich Castellano here, the Smile Doctor. We're here today with Terry. Terry's doing an image lift procedure. We did a little bit of the facial fillers. Terry, how are you feeling, dear?
Great, wonderful.
Terry has had some of the relaxing medicine. We're going to do some of the numbing, and she is young and she wanted to start early. She wanted to tighten the neck and the jawline, so she looks amazing. We gave her a little bit more volume, and you see her neck and jawline. And now we're going to tighten up in through here, and she's going to love her results. And so Terry had mentioned that, I'm going to just turn this around over here. Terry had mentioned she'd been following us, and then can we tell the story of one of your family members?
Sure.
You said, what was it that they said that prompted you?
Well, I've been kind of wanting it for about a year, but I was just thinking I could put it off till I was 60. And
How young are you now?
54.
54. And we have a lot of patients your age that come through.
Yeah? Okay.
Oh, yeah.
And then my son was sitting around. He goes, Mom, my youngest one, you're so pretty and you're so gorgeous, but I think you would look a lot younger if you did something with the skin under your neck.
So he prompted you, huh?
Right? So then I made an appointment a week later.
But you guys are close, right? Because normally we
Yeah.
would say nobody can say anything that's not nice to Terry. But when you're close, it's a family member and they say things,
Oh, no, I
wants what's best.
appreciated it.
Yeah,
Yeah,
he wants
no.
what's best for you. So it is so important. We always have to be careful what we say about other people's appearance. So today we've done a little bit of the facial filler. So now I'm going to do some of the numbing medicine. So for those of you who are just joining, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. We're in Tampa and in the Villages. We just came back from New Orleans at the ASAPS meeting, and it was wonderful. Did an amazing training for the plastic surgeons with great results, very powerful, great testimonials from that.
Make sure let the scoot out.
And thank you very much to Charlene and Lainey and Nina. They set everything up perfectly for us, makes it very easy. So this is a modified SMAS plication, and we're also doing a laser lipolysis to tighten in the skin, and then that's in combination with the fillers that we just did not too long ago. So thank you all for watching, thank you all for sharing, and those of you that want more information, you go to our website, imagelift.com. We have our books that are out on Amazon. We guarantee we can make you look younger in the Smile prescription. And you got to read some of our books, Terry?
Yes,
Were they helpful?
Absolutely.
Okay, good. All right. It's a wonderful resource. And, patients just want to get to know us better. You can watch our videos, read our books, come to our seminars. If you go to imagelift.com/events, imagelift.com/events, I'm going to turn your chin all the way up like this. There you go, to the ceiling. And then I just draw through here, and we do a little bit of the numbing medicine. And so, Terry, if you decide you want a little more relaxing, you let us know. But otherwise, you'll just feel a little bit of the numbing like before. So, little pinch. Do you feel big pinch, little pinch, not too bad? So just a series of little pinches like this. And then when we're done with the numbing, you really don't feel much of anything. Pressure pinch, little pinching. How long have you been in Florida for, Terry?
I'm a Florida cracker.
There you go. Me too.
Oh, really?
Been here all my life. So this is the tumescent solution, and I like to use the spinal needle to deliver it. It's just easier to control. And when you stay in the subcutaneous plane, you feel a little pressure pinch. Do you feel big pinch, little pinch, not too bad?
I'm good. I'm wonderful.
If you feel you need a break, you let me know. So for the physicians and students that are watching, the technique, this is totally subcutaneous. And if you stay in the subcutaneous plane, they feel very little. Some people are a little more sensitive to it, so you got to go slowly. And it's wonderful because when we were at the New Orleans conference, there was a surgeon that came by and said, "Hey, Rich, I was watching your videos, and we were talking about surgical technique, and it was really cool." And I said, "Hey, well, I really appreciate you watching." And he gave me some insight. He said, "Hey, here's some things that I would consider." That was Dr. Richard Gentile, by the way. And so we had a lot of great interviews at ASAPS in New Orleans. That was
the Orlando one. The Orlando one. No, the Orlando,
New Orleans.
Wonderful. I saw those videos.
Let me turn your chin up here like this. That's perfect. Okay. And so with the tumescent solution, now I'm just coming across the angle of the mandible. Little pressure pinch there. You feel big pinch, little pinch, not too bad?
Nothing.
Okay. And that's typical that a lot of patients really feel very little or nothing. And so a lot of doctors, colleagues, and patients will say, well, how can you really do this procedure under local? You're watching it here right now. It is possible. And patients, the moment you tell a patient that they can do a lifting procedure and they don't have to have general anesthesia, well, you get their attention. They're like, great. because they don't, we want to be comfortable, we want to be relaxed, but you don't want to be out 100%. It's not necessary. And so that's why we like to do this, so people can be aware. So thank you for watching. Thank you for sharing. If you have questions about pricing, you can call our office, 813-463-9245, or you can also go to our website, imagelift.com/pricing. Everything's looking good. Thank you for watching, and thank you for sharing. Definitely let your friends know you're watching live surgery, because if you tell them you're watching... I
feel tight already.
And she feels tighter already. Well, with the numbing medicine, it does make you feel full and tight. But it's like when you go to the dentist office and the lip feels a little more fat and swollen. It'll feel that way because it is a little bit of swelling, plus the numbness on top of that adds to that unfamiliar sensation. So it will settle for sure. Everything's looking good. Oh, thank you for sharing. Appreciate that, Ginger. And but definitely let your family and friends know, because this is the future of medicine, to educate on procedures through this manner, through social media, through videos, through live video, and to avoid more invasive treatments when there's a less invasive, very effective option. And that's what we're all about here at ImageLift. Thank you for watching, and thank you for sharing. If you're just joining, I am Dr. Rich Castellano. Let me turn your head this way a little bit. We're in Tampa and the Villages, Florida, here with ImageLift. And we're just doing the tumescent solution numbing medicine for an ImageLift facelift we're doing today. Normally, I tell my patients that we're going to go for the gold. Now, Terry had a different request. She wanted us to go for the platinum. So we're going to go for the platinum today. We are going to go all the way, but it's still going to look very natural. And we love doing what we do. It really is a lot of fun. The best part about what we do is the people that we get to work with. It's always interesting, never boring, and always rewarding, because we want to make a difference in the lives of others. And even if we have to come back and do another treatment another day, that's better than going too far. But it's a process, because if we're lucky, aging keeps coming for us. We can definitely get significant improvement that people are happy with for years, but the aging process does continue. So we take all of those things into consideration and make a plan that's right for you. Terry, how are you feeling?
Feel great.
Everything is looking good.
I don't feel anything.
Me neither. Okay. And you've seen our videos too. Was that helpful to watch our videos?
Oh, absolutely. And that's why I'm doing this one, to help people.
Yeah. Well, thank you very much. Please, lots of likes and shares for Terry for being so generous and letting us share her treatment, and she can watch her treatment too. And it is pretty amazing to be a part of what we do. We have an amazing team, and I love our amazing patients, and we love hearing when they tell us their results are amazing. All right, thank you for watching, and thank you for sharing. And
now, why do I feel tight? I mean, is it just because of the...
It's a good question. Yeah, you feel tight because when we put the solution in there, the numbing medicine, it is a little swollen, and there is a little bit of pressure just from the tumescent solution, so that's number one.
But you can still see the loose skin.
Oh, yeah, for sure, right. She was asking me, so that's a very good question. I'm going to repeat that. So Terry was concerned. She says, let me turn it this way. She says, if she's swollen with the numbing medicine, is that swelling going to make it more difficult to get rid of that loose skin? She doesn't want us to leave any loose skin behind.
None.
Right, there you go. I hear you. So we're going to go for it, right? There was no pause from that none. She's like, the timing was there. So, Terry's our A+ student looking for extra credit. So we tell all our patients the same thing, that we're going to go for the gold, the platinum, go for the best. Now, the likelihood we need to come back another day to take more for someone like Terry is pretty low. It's not a 0 for anyone, but it's better to come back another day rather than go too far. And then we have to temper that by saying, we want to make sure our expectations match what the procedure can do, because if our expectations are too high, there's two potential risks. One risk is you don't want to go too far, or choose something that goes too far, and that's my job. I won't let that happen. And Terry's got realistic expectations, and she's confident person, and she's a wonderful smiler too. She's a beautiful, beautiful person, and again, that's why it's so nice. We love our patients. So she's got great expectations. The other thing is we want to make sure our expectations are in line, because sometimes people can get a nice treatment and get a really nice results, but they may not be happy because their expectations were so high. So we're going to go for the gold for sure. Then we let the dust settle. We get those after pictures at around a month. She'll pass the grocery store test at around 7 to 10 days. You walk into the grocery, no one really does a double take. And we have arnica patches. Yeah, we've got the arnica patches, and we'll be using some of those as well. So if you stick around, you'll see how I like to use the arnica patches.
Now, what's that for the bruising?
The bruising, anti-bruise patches. So everybody's been using arnica for quite some time, and thank you to Sierra and Acumen they do provide us with those patches when we use them for our patients on video, so we can educate. And patients have been giving us a good response, saying, hey, they really like how it helps with their bruising and swelling. So you turn your head all the way to the middle and chin all the way up, 27. So do you feel any discomfort at all, Terry?
Not at all. Mm-mm.
Everything's looking good. So you might feel a little pinching here, a little pinch, or not, a little pinching. Just like to do a little bit more than numbing medicine. And I'm going to start out with the laser. That's the laser lipolysis. Yeah, it was a very interesting meeting in New Orleans and ASAPS, and really exciting to see. I met doctors from all over the world. Let me turn your head all the way this way. Very good. And now I'm doing some numbing medicine for the incision line for the physicians and students that are watching. You know, for a while I would always mark the areas, mark across the incision, but I've been doing this for so long, I know where the areas are. And patient appreciate.
Are you doing in the ear or outside the ear?
So it'll be right along the edge of the tragus. Some people consider that to be inside the ear, but it's technically just on the outside for the ear canal. But for the ear structure itself, a lot of people, when they look at it, they say, geez, that feels like it's right on the inside of the ear. But the goal is that it's very difficult to see that incision location. So I'm not using the marker out here. Let me turn your head this way, because
am I asking too many questions?
You can ask as many questions as you'd like. That's what makes this fun, and that's what makes it, engaging. And then the viewers can learn. When you ask a question, they learn. When they ask questions, you learn. So it's all for the benefit of everyone. There's no such thing as a bad question.
So the stitches go on the inside of or the outside of the ear?
So the technical placement is, it's actually on the edge of the tragus. Now the tragus is that little bump in front of our ear, in front of the ear canal. It's like the Latin word root for goat, like a little billy goat's chin. And so that's the tragus. The edge of the tragus is where the incision, where the stitches go. And then right in front of the ear, in front of the earlobe, is the other areas we put stitches in, right in the hair tuft, the temporal hair tuft. Okay, so we're done with the numbing medicine. So what we're going to do now, I'm going to put your head all the way towards the middle like this. And then we're going to put these little eye shields that just protect the eyes. So your job is to keep your eyes closed, number one. Number two, we protect the eyes with the eye shields. Number three, I only activate that laser when it's in a safe place to do so. So Charlene's setting up our laser. It's a Cynosure triplex. Let me turn your chin all the way up. And it's we have 1064, 1320 wavelength. And so there's a fiber optic that we use under the skin to deliver the laser energy, and it breaks up the fat cells, and it also creates a thermal injury under the skin. This is a bipolar cautery. Everything's looking good. So as you can see, there's really no significant bleeding. And then now that the laser is all set up, so this is the fiber optic, this is the helium neon beam. You can see that's the red beam because the ND YAG laser is not visible to the human eye, but you can hear its energy. When I tap on the pedal, you hear that little popping. 12.5 hertz, and that is the laser delivering the heat injury to the fat cells and under the surface of the skin. Terry, do you feel any discomfort at all?
Not at all.
Okay, me neither. Everything is looking good. And Charlene has everything set up perfectly, makes it very easy for us. Thank you for sharing. Thank you for watching. So I like to follow here with my non-dominant hand, although I do operate with both hands, and this allows me to control the direction of the skin. I'm going to do a tiny bit of cautery here.
Are you doing the jowls now or the neck?
Well, both. I'm doing the jowls with the laser, and then I bring it down and around through the neck, so I'm actually doing a little bit of both. And I move it between both of them, because as I deliver the heat, I like to do a gradual increase in the temperature over the entire area. Thank you. Any questions you have, you let us know. So then, just across the jawline here, and we thread. This was a question that Dr. Gentile had. He says, be careful in this area right here. And some people, their jawline, if it really juts out, it's harder to access that area. And for Terry's anatomy, it's much, much easier. And then with the submental incision, it gives me a little bit more leeway to place that cannula across the mandible and still access subcutaneous without getting out of the tissue plane. Everything's looking good. You're gonna love your results, Terry. Very excited for you. Patients are starting earlier because they don't want to wait until they have advanced aging changes. So when patients ask me, well, when should they start? Then I say, well, come for a consult. If you see something you like, you can often enjoy it now, making sure you have the right credentialed, experienced doctor. And if you say, well, it doesn't really bother me that much, you can leave it be, that's fine. But you certainly want to be as preventative and proactive as possible, because when there's more advanced aging changes, then it is more difficult to get improvement in those circumstances. But the good news is we have more options now than we've ever had before, more effective options, and especially a lot of non-surgical options. Hello, Yolanda. Thanks for watching. Good to see you. Everything's looking good. How are you feeling, Terry?
Relaxed.
Good. I feel pretty relaxed too. Perfect. Okay. So removing some of the fatty tissue, and then we're also creating a thermal injury under the skin that tightens things up. Thank you for watching. Thank you for sharing. We will have more broadcasts later, so if you're following us, then you will see our future videos. And for the physicians and students that are watching, please watch our, make note on your calendar, October 18, 19, 20 at the Tampa Convention Center. That's our Practice Profitability MD. We are helping doctors profit lifting. If they want to build their business, build their profits, and take better care of their patients, we tell them how to do that. We teach it. And was very, very well received at the ASAPS meeting in the educational course. Very well attended.
It almost feels like you're giving me a massage.
We are giving a massage just right under the skin. Everything's looking good.
Is my skin tough?
I would not say that your skin is tough. And Terry had a question before. She says, is your skin thin? Now, it's normal that we feel some of the fibrous tissue between the skin and the deeper structures. Just below the skin, the subcutaneous layer, is what we call the SMAS, the subcutaneous musculoaponeurotic system. Stands for SMAS is the acronym. So the skin has these fibrous attachments to the SMAS, and if you're going to lift the skin or work in the subcutaneous area, as we are doing right now, then you do need to break some of those fibrous tissue bands. Now they will heal back together once we're done, and that's why we put the wrap on to give it time to heal afterwards. But for now, we want to lift those up so we can access the subcutaneous area, and then we'll be doing some tightening across the SMAS and removing extra skin and fine little stitches in front and behind the ear and under the chin. Temperature, please. Everything's looking good. Okay, thank you. It's wonderful. The technology allows us to have a global audience between, yeah, that's fine. With our little Verizon and AT&T plan on our cell phones, allow us to broadcast. We have doctors and students from all across the world that follow us and ask questions and learn from what we do. So, for those of you who are just joining, I am Dr. Rich Castellano, double board certified facial, plastic, and reconstructive surgeon. We're in Tampa and in the Villages, Florida. We're doing laser lipolysis and a modified SMAS application image lifting procedure under local anesthesia. And this video is live, of course. We don't filter or edit our videos, so you can see exactly what we do and how we do it. Patients really appreciate understanding my personality and how my patients interact with me, and their results, of course, matter. But it's not just one part of the puzzle, it's the entire picture that matters, because you want to make sure. I'm going to turn your chin all the way up. Is that okay for you like that, Terry? Okay. How are you feeling?
I'm good.
Okay.
Yeah, I'm no problems.
Very good. You need anything at all, you let us know. You'll be done before you know it. And then I like to see patients back tomorrow, and then 1 week I give my cell phone out to all my patients. That way if there's any questions, they give us a call. We really don't get a lot of phone calls, but patients find it comforting that they can reach me at any time. Well, I like to do a wrap afterwards. We keep the wrap on until the next day. Then I will replace that wrap and go through the wound care on the first visit. And then we'll take pictures at around a month. Now, recovery is the social downtime versus the physical downtime. Socially, we tend to get back into our routine, errands, shopping, things around the house within a day or two. I mean to say physically. Physically, we get back into our routine. Socially, we pass the grocery store test. 7 to 10 days, you walk into the grocery, nobody really does a double take. Thank you for watching. Thank you for sharing. Everything's looking good. And thank you again to our team, Charlene and Lacey and Lainey and Nina, for setting everything up perfectly. Makes it very easy for us. So I monitor the heat by my fingertips. I can feel the warmth. We have an external temperature monitor that Charlene has, and you'll see a little laser red dot that shows where we are measuring the temperature. And then I also monitor the level of energy that the laser delivers. So between the energy we give, the external monitor, and then my experience just feeling the temperature, we make sure that we have a safe experience for the patient and get the most improvement possible. Perfect. Show me the highest. Everything's looking good. Thank you for watching, Elizabeth. When someone wants to know the pricing, you go to imagelift.com/pricing. Tú quieres de información de precioso, precioso, llama a la clínica 813-463-9245 or go to imagelift.com/pricing. Very good. Thank you for watching. Thank you for sharing. Terry is going to love her result. It's going to be a nice improvement. It's going to look very natural. There are 4 basic things we do to the face when we do cosmetic treatments. If it sags, we tighten. Temperature. If we lose volume, we fill. Sun damage, wrinkles, and sunspots to the skin, we polish and repair the skin. And then the 4th area is better than all the others. That's our behavior. Nothing looks as good as Mother Nature's free facelift. Our smile. Now there's 4 principles for good plastic surgery. Safety first, you must look natural, prevent future aging changes, and let's get as much improvement as possible. And so, you can't make things perfect in plastic surgery, you just want to make them better, and if you do make them perfect, they can look unnatural or extreme or severe. So the best perfection is maintain the natural look and deliver the best natural looking results. So safety, you must look natural, prevent future aging changes, and let's get as much improvement as possible. Okay, so I'll give this to you, Charlene. Thank you for watching, thank you for sharing. So now what I'm going to do is I'm going to turn your chin all the way up. That's perfect. We're going to do, lift the skin and do some little stitches under the chin. Everything's looking good. There's no restrictions in what people eat afterwards, and then chin up. That's perfect like that. And then, I know you've had some of the relaxing medicine, Terry, so if you think you need a little more, it's easy for us to give that to you, by the way. Do you feel comfortable, or do you think you need a little bit more of the relaxing medicine?
I think I'm okay.
Okay. This is what I tell patients. If you change your mind, let us know, and we can always give you more, as long as you're comfortable. And some patients, the medicine sneaks up on them, and they drift off to sleep because doing the procedure, they can't tell what I'm doing. They know I'm there, but they may feel a little pressure, but they don't feel pain. So that is the benefit.
Oh, I'm very alert. I know what you're doing.
There you go. So, and some patients are more alert than others, and as long as you're comfortable, that's fine. But I certainly can give her more relaxing medicine if she wants to. That's always patient preference. Very good.
Yeah, I feel no pain, nothing.
Yeah, perfect. That's the way that it's supposed to be. Everything is looking great. And so you'll feel it when it gets a little tighter. Perfect. So make sure you're following on our social media, Facebook. We're on Facebook. We're on Instagram. And we're also on YouTube at Image Lift. Instagram's Image Lift now, and YouTube is Image Lift. Facebook, look us up as Image Lift.
Now, what are you doing there? Cutting?
Lifting up the skin. Mm-hmm. Lifting the skin. There's little fibrous adhesions between the skin and the SMAS below. Mm-hmm. So when we remove those fibrous bands and lift up the skin, it allows us access, and we can start tightening the underlying structures, and then the skin, as we redrape it, then we remove the extra skin.
Is there a lot of skin there?
Well, it's all relative. It's certainly not too much, but we are going to go for the platinum as you requested, mm-hmm. not the gold. We're going mm-hmm. beyond the gold. Mm-hmm. Going for the platinum. Exposure for me, please. Very good. I'll put a little bright light here. Now I use the gauze to tuck in, and that gives me a little bit of exposure to just see things better. If there's a little vein or something that I need to cauterize, then I just do that as we go along. So there can be veins that just come from the SMAS layer, and there can be veins that are on the skin surface. You felt a little, so she felt a little pinch there?
No, I didn't. My little thing on my finger fell off here.
Oh, okay. Well, we'll get that taken care of for you.
I got it back on.
Oh, you're okay. There you go. There you go. You already got it. Well, if you feel any pinching, you let us know, and I'll give you more numbing medicine. Very good. And we monitor oxygen, we monitor heart rate, we monitor blood pressure, all to make sure it's safe for the patient. This is definitely safer than IV sedation or general anesthesia. Very good.
There's a little pressure there, but no big
deal. You'll feel some pressure, and that's normal to feel pressure, yeah. Normal to feel the pressure. Everything's looking good.
Am I platinum yet?
Well, we're not there yet, right? Are we there yet? Are we there yet? Right? But we're getting closer. We just got closer. I'm very happy with what I see. And listen, I can relate to Terry. We all want it right now, and we want the best results, but we are getting there one little step at a time.
No, take your time.
Yeah, oh yeah. We're not in a hurry. We take the time we need. Always fast, but never hurry. Perfect. Okay. So I tuck the gauze in, and it gives us exposure Thank you for watching. Thank you for sharing. If you're just now joining, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon here in Tampa, Florida, and in the Villages, Florida. Perfect. And sometimes it's just a little vein that's on the skin surface, which is over top, so you need to look on the top, you need to look on the bottom. Make sure you're getting a good look. Perfect. And then when you do that, putting the gauze into place, it gives you better visualization and exposure, and it also does a little bit of elevation of the skin as well, so that is a little bit of the dissection technique to just smooth things out. So it's a combination of ways that we use to elevate the skin flap. Very good. Everything's looking great. Okay. Perfect. So when we're doing these procedures, you know, facelifts started out under local anesthesia many years ago. And when anesthesia techniques improved, then people just started doing everything under general anesthesia. And then cosmetic surgery procedures evolved, and they wanted to do more and get better results. And so they were doing bigger procedures. But I'll never forget the meeting that I attended where one of the most experienced facial plastic surgeons in the whole room just came out and said, look, he's done all the big procedures, and he said, you know, less is more. We used to be so fascinated when we would see someone who just did this amazing, crazy big procedure, and wow, that's so technically difficult because we're a lot of guy surgeons, a lot of testosterone, and we want to get the biggest and best procedure. And now everybody's saying, well, less is more, which I certainly agree. Ask a surgeon, you know, if you can do less of a procedure to get the result, that's always desirable. So we try and do the least amount of surgery that's going to give you the most improvement, the platinum results, that you still look very natural. And patients today, they definitely don't want to be overdone, and we won't let that happen. Very good. Thank you for watching. Thank you for sharing. We will be rebroadcasting later, so make sure you're following. You just click follow on the social media button there for Facebook or Instagram. You get more videos and learn about what we do. Perfect. So the fancy word, we call this hemostasis, where you're just getting the little vessels to cauterize so that they don't leak, and makes for a better result. You can see better what you're doing. And I like the bipolar cautery to do that. That's a hyfurcator cautery device. Been around for quite some time, very reliable, very safe, and simplicity is key. It's a very simple. There's a lot of technology that gets very complex to do these things. It's pretty simple to cauterize, so you don't need the most advanced technology to just do some cautery. And the most advanced technology that matters, of course, is the surgeon's mind, the surgeon's brain. That's the real key to getting your best result, or the best use of the tools that you have, is the doctor's experience. Okay, so now I'm going to be trimming a little bit of the fatty tissue here. Everything's looking good. And so I tell patients, so Terry, if you need a little support in your neck, or you need anything else, or you let us know. How are you feeling, Terry?
I'm good.
Okay.
You know, I have hardware in my neck's bothering me.
Do you want me to put a little, let me put a little cushion behind your neck? Hit the button for me. I can do that for you.
We tried it, but she...
Yeah, no, you're okay.
You want me to try a little? Okay.
No, I'm good.
Because if you need a chance to move, and I do have a lot of patients, what happens is they'll have neck or back issues, and then just adjust as needed. Just let me know, say, hey, I'm going to move my head here, and say, great, and we can do that. The good news is it's not going to take too long, and if we need to give you a pill for pain, we can give that to you as well. So we just take it as we go, so let us know. We can adjust your position as needed. Okay, she's fine now. She just wanted to adjust her neck some, so she's fine. If you need a cushion, you let us know.
I'm good.
Everything's looking good. Perfect. Can you make a note for me to call Andy, please?
Sure.
Thank you. All right, so I'm just trimming some of the subcutaneous fatty tissue. You can see that here.
So how much do you take it off? Is it measured?
So yeah, I don't put it on a scale, but what I do is I take what's there, because you can go down to the level of the platysma muscle. So that's a very good question. Normally, I'll just expose the platysma muscle. There are some doctors that they remove glands and they remove muscles in the neck, which I think gets too aggressive and too severe. So I don't usually recommend that, and most of my patients really don't want that. So there are options to choose from, but we have designed this procedure so that we do the least to get the most results, and we definitely look natural. Now, do you feel a little bit of pinch here? Perfect. Everything's looking good. Thanks for writing that down for me, Lainey.
Yes, no problem.
So the laser lipolysis removes some of the fat, then I'll remove some of the fat here. I call this as liposculpting. And then I'm going to do the tightening. So the combination of all of these techniques gives us the best overall results. I've done over 4,000 of these facelifts under local anesthesia. You get the hang of it after a few thousand. Perfect. Okay.
I feel pretty already.
There you go. Well, you looked pretty before we did a thing, and now, of course, the most attractive thing we do to our face is our smile. We're going to tighten things up and refresh as best as possible. I'm very excited about your results. Right here. Let's see. Okay, good. And now I'm going to be doing platysmoplasty. So the platysma muscle, we're going to stitch with the 2-0 Merceline, the 2-0 Ethibond, and then I just do a running continuous stitch. Let me turn your chin all the way up. That's perfect there. And if you need to adjust, you just let me know, okay?
I might need a pillow under there so I can put it up more.
Here's what we'll do is I'll have them go ahead and let me have them put a little cushion under your neck.
Yeah, try that.
Yep. We'll put a little cushion. That's no problem. Not a problem. We need to put some, can you get some of the chucks, 4 of them? Can you do that now? You need a,
Yeah.
can you grab that right here, right now, Lainey? Right there. Thanks. Perfect, everything's looking good.
You want chucks, you said?
Yep, the green ones, 4 of them.
Okay.
And then can you put those under her neck, please, and under her head?
Yeah, let's just try that and see if that gives me some relief.
And so let me have you start with 2, Lainey.
Okay.
And then if you just tuck it under here, there we go. Perfect. Now how is that? Is that a little bit better there or higher? Or?
I think that's better, yeah.
That's better? Okay, just keep those nearby, not there, because then, thanks. Okay, thank you, Lainey.
Yeah, it's nothing that you were doing, it's just my neck. It's
Yeah,
just.
if that's a better position, let us know. And if you need us to adjust, we can put more if you need. Okay. All right, very good. Thank you, Lainey. So those little types of adjustments they're easy to do, and then we just keep on going. So the platysma muscle, I'm grabbing the edges of the platysma here. Very good. Perfect.
Now, Why would you suggest to do, like, when you do your neck, you should do your jowls as well? It kind of goes one hand in hand.
Yeah, so what happens, they definitely go hand in hand, and some people get more of a result and some get a little bit less. So the answer is it depends on your consultation, what you're looking for, and the type of procedure that you choose. There are some patients where I'll make a recommendation and they say, you know, I know that's your recommendation, but I want to do something else, and let me see how good of a result I can get with this. And that's fine, that's perfectly fine. And if the patient's happy, great. If they want more treatment, we can always come back and do more. So the consultation is it customizes and is so necessary what is done. I see just a little bit more fatty tissue that I want to address here. Perfect. Okay, very good. So we're stitching through, and she'll feel a little bit tighter under here. Your neck and profile are looking better as we speak. Looks natural, not overdone. Perfect. And then I just continue this suture all the way back to the submental area.
And these sutures stay dissolved?
This one stays in the tissue and gets covered by scar tissue, and very rarely does it surface like a splinter and then I remove it. It's easy to take care of, but once it's there for the first 4 to 6 weeks, the scar tissue settles in and you don't really need the stitch as much. So, but it's uncommon, but anytime you put a stitch in, sometimes it can surface like a splinter. So we talk to patients about that and let them know everything's looking good. Okay. Thank you for watching. Thank you for sharing. I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. We're in Tampa and in the Villages, Florida. And now that we've done the platysmoplasty, for the physicians and students that are watching, it changes the exposure. It tightens things up so I have a better look at what is there, and then I can just do a little more finesse contouring, which I like what I see. I'll just trim just a little bit in through here, not that much. Okay, so I like what I see there. Perfect. Shine a light in that area. Oh, that's perfect. Yeah, you're great. Thank you for asking. Switch to the other side for me, please. Very good. Yep, and now that I have exposure here, I'll also place some gauze on this side. So yeah, it was really amazing to be in New Orleans, such wonderful people, and then it's so funny, I get caught up in the meeting and then I did not get into the local food, I'll have to confess. And I eat veggie anyway, so a lot of the New Orleans dishes are not super veggie friendly, but that's okay. I had a good time, enjoyed the environment. It was a great party. If you go to our Facebook page, facebook.com/imagelift, you can see a lot of the pictures from the party. That was just a lot of fun, hanging out with the plastic surgeons. And saw a lot of Tampa plastic surgeons that, you know, I don't get a chance to see them, but when we go to the meetings, we see each other. So that was really nice to connect. And I got to meet with Dr. Yoon, who's up in Detroit, Troy, Michigan, and he's got a wonderful practice and a wonderful TV presence, and he does a wonderful, check out Dr. Yoon's podcast. He definitely has a lot of great information, and a lot of my patients follow it.
Now, what are you doing there?
So a little bit of cautery. Could you feel any pinching
Nope.
at all? Okay. Very good. How about here, a little pinch? Perfect.
Yeah, I feel absolutely nothing.
Very good. Okay. How about here, a little pinch?
Mm-mm.
Okay. Now release for me, please. So I can see here already, I mean, look at her jawline. You can see what a difference. So now that's a nice sharp jawline. I'm going to turn your head all the way this way, and we're going to be doing the lift from this side. Now, is that position for your neck okay?
Oh,
or do you,
better, much
yeah,
better.
okay, yeah, that way you
Gotcha.
can shift. And see, the littlest shift makes patients feel more comfortable, and it's easy to do those things. So now I use my 15, where we can make the little skin incision and just a little bit of the hair right through here. You don't lose the hair because it's just a little wedge. The old-fashioned incisions used to take away some of the hair, right? You've seen that before, Terry. So she, we talked about it. She did not want to have that kind of hair loss. So what we do is, it's called a hair sparing incision. And this is the edge of the tragus right here. Here's the tragus. So we go right along the edge.
Are you in the ear or out the ear?
Well, that's technically on the edge of the tragus. It's not on the inside of the ear.
It always feels like it is.
It's right. Do you feel any pain at all?
No.
Okay. It's right kind of on the edge, the border of the ear. That's why it hides so nicely. Very good.
I can only hear it.
Yeah, you'll hear it. You might hear crunching noises and things like that. Ear forward for me, please. Thank you for watching. Thank you for sharing.
Feels like you're cleaning my ears.
So right now we're removing the fibrous attachments that attach the skin to the underlying structures. There is somewhat of an extension of the fascial plane of this mass here. Can you keep that exposure, please? And I'm going to do a little bit of cautery here. So you can see where the vessel is right there. Now while I'm cauterizing, if I hold pressure here on the skin, the vessel is compressed and it makes it easier for me to cauterize. It's harder to cauterize if the vessel's open and just freely flowing. So holding pressure, cauterizing, and when you cauterize too, you can prep. Do you feel a little pinch there?
I'm okay.
If you feel a pinch, you let me know. I'm going to do just a little bit of numbing medicine. Perfect. And so, as you can see, I mean, there's very little, no real significant bleeding. Perfect. Thank you for watching. Thank you for sharing. If you're just joining, I am Dr. Rich. So it feels a little pinch there, so then what I do, a little bit of numbing in that spot. Sorry, you felt that pinch.
No,
How about
it's
now?
okay.
Do you feel any pain at all?
No,
Very good. Okay, release for me, please. So then in the preauricular, perfect. So the first part, the skin incision has been made, and you want that to be for the students and physicians that are watching, you want that to be, certainly that's an up and down incision. Now we're going parallel to the skin, and so I do it one step at a time. First the skin incision, then a little bit of undermining just right around the incision, then there's the deeper undermining, which then I use the Kahn's facelift scissors for, and you can do that sometimes with the scalpel, but it's a little more controlled with the Kahn's facelift scissors. Everything's looking good, so that's why it's going to be hard to improve on her beauty. Oh, Norman. Hi, thanks for watching, Norman. Okay, very good. Yes, it is hard to improve on her beauty, that's for sure, but we're just helping her look a little younger, because of course what looks the best is Mother Nature's free facelift, is when we smile. And Terry has a great smile. How are you feeling, Terry?
I'm okay. I feel something dripping in my ear.
You'll feel a little bit of fluid though, yeah.
Yeah, there we go.
Little fluid.
No, I'm good. I'm fine.
Okay, very good. Thank you all for watching. Thank you for sharing. All right. I was doing one patient's lift, and her daughter got on and was watching, said, "Hi, Mom." And I said, "Oh, your daughter's watching. Where is she watching from?" She was watching from North Carolina. I said, "Well, that's so nice." And I said, "Well, what does your daughter do in North Carolina?" She said, "Oh, she's an attorney." And so we laughed, and then she said, "Oh, Oscar's here now." I'm like, "Well, who's Oscar?" And she says, "That's her dog." So we have dogs watching us do the procedure. And so, but that's through the video, not live for sure. Okay, everything's looking good.
This is a totally different feeling from the front.
Yep, it's a little bit of a different sensation. You'll feel some pressure. Are you feeling any discomfort at all?
No.
Very good. I'm very happy with what I see. The neck and jawline look amazing.
It always feels like you're underwater.
Right. You'll feel that kind of swelling or a little bit of the pressure, but we're definitely not underwater. Okay.
Yeah, I see it tighten it.
So I can see here, as I'm lifting and elevating, the pocket extends all the way through, and that allows me to access the smashed tissue layer below, which we'll tighten that with the stitch, and then with the excess skin, we'll remove that and stitch things up. Everything's looking good.
And you do both sides?
Yes, that is correct. Both sides. That is correct. Always both sides. Occasionally, I may have a patient that has a medical condition, or they got a lot of scar tissue from radiation or something like that, or they've had a big parotid surgery. Then maybe I'll sometimes do just one side and under the chin. So I can vary it if needed, if someone has had treatments in the past, because sometimes we need to have parotid surgery. Not too common, but it does happen. Perfect. All right. Exposure, please. So now we expose.
Now, this is an odd question. Like, if someone has a stroke that has the facial that's droopy, can you fix that?
So once someone has had a stroke, and it's, first of all, I've never had that happen to any of our patients doing the procedure, but if someone has already had a stroke, there are procedures that can help address a facial drooping. And so those tend to be a little bit more complex. They call them nerve reanimation procedures, or you can even transplant even in a muscle that can, gracilis free flap transfer, that you can activate the nerve, and it gives them a little bit of activation. So there are things that can be done. Mother Nature's is always the best, but if something like that happens, there are options to address it. I've had some patients where we've done fillers, and they've helped improve asymmetry from Bell's palsy or stroke or things like that. So yes, those things can be addressed. You just need to see your doctor and see what you're a good candidate for. Very good. Thank you all for watching. Thank you for sharing. Behind the ear for me, please. If you're just now joining, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. We're here today with Terry. Thank you very much, Terry, for allowing us to share your procedure and be educational for others. This is the best way to learn. You used to have to go to the university and watch over the shoulder of the attending, but now you can, through your cell phone, through YouTube, you can watch these things and learn even live. It's even ask questions while they're going on. I mean, it's pretty remarkable what technology allows us to do. Perfect. So again, I'm using the gauze here. Okay. So then I'll tuck the gauze, and you can see we go all the way through just to check and just remove some of the drainage there. Very good. And behind the ear for me, please. Very good. Up front, please. Okay, so now I'm going to do the SMAS plication. And like I said before, for the physicians and students that are watching, when you do the tightening of the SMAS, it changes your exposure. It improves the exposure. So if there was an area that you wanted to cauterize a blood vessel or something and wasn't as easy to get to, once you do the plication, it tends to be easier to access everything that's in your surgical field and visual field. Very good. So I go back to the 2O Ethibond, and we will need another one of these. So okay, everything's looking good. So I grab the SMAS closer to the jawline, and we're tightening that area back. Perfect.
Can we
Can I get another Ethibond? Yeah, thank you very much.
Thanks, Amy. You're welcome.
Okay. So this is a SMAS plication, modified SMAS plication. Everything's looking good. We'll be tightening here and stitching things up. Okay, 1 or 2 is fine, thank you. Very good. So this is the Merceline, the Ethibond suture. Now, and expose in the front, please. I like to use the 2O Vicryl for the preauricular SMAS plication. Okay, so we flash the suture. That's with the needle driver that pinch holds the tension down while I throw it down the knot. So Lainey, can you, I want you to come over and just tap a few of these little buttons here,
Okay.
please. Yep. So for this one, see it's a little arrow and save, just tap
Yes.
save right there. Tap
Okay.
that. Yep. And good, now hit share. And then hit the camera up on the top. And then tap live. You see that
Got
go
it.
live? And then hit
Go live.
Yep, thank you.
You're welcome.
Very good. Everything's looking good. Thank you for watching. Thank you for sharing. If you're just now joining, I am Dr. Rich Castellano, double board certified facial, plastic, and reconstructive surgeon. We're here in Tampa and in the Villages, Florida. Can you expose for me, please? Very good. Okay. Okay. So we're just doing a little bit of cautery just to seal the blood vessels. And if you're on Facebook, don't forget we're on Instagram. We're also on YouTube, and we're also on Facebook, Instagram, YouTube are the main ones. We were on Periscope for a while, but Periscope is a little less active, so perfect. We will be rebroadcasting soon because we'll be doing the other side, so make sure you are watching and are following. Terry, is that position okay for your neck there, dear?
I'm okay.
Okay. If you need to adjust, you let us know. Perfect. Okay. Behind the ear for me, please. Release, please. So now I use the Mayos, which helps me to trim the flap. And can you have them come back in, please? I didn't hear it. Yeah, again? Oh, yeah, okay. Well, Lainey, on this one, I just need you to pinch to so that they can get a little closer of you to zoom. Thank you. There you go on the middle one. If you just bring it out so that way there you go. A little bit more, a little bit more. Yep, thank you very much. Okay. So now I'm reshaping the tragus and accommodating for where the earlobe is going to fit in the skin flap. Perfect. So you can see this extra skin here that we're going to remove. Not necessary, so let's get it out of there. And then you can see how that skin flap fits back nicely. And I'm going to do some adjusting through here. Perfect. Okay, right now an Alfred, please. And then a little bit more bipolar cautery. Everything's looking good. Okay. So just a little cautery for the blood vessels that are here. Everything's going very well, Terry. How are you feeling, Terry?
Okay, I'm good.
If you need to change your position or you need additional relaxing medicine, you let us know. Find here for me, please. Perfect. So the cautery just helps to make sure the blood vessels are sealed, and a little drainage is okay, but what we do is when we put the wrap on, the wrap holds pressure to make sure that it closes the blood vessels, allows the healing that we need for the best results. Perfect.
Thank you.
Okay, very good. Release that for me, please. Okay, 2 of our. So now I do a deep suture. And when I
Just
do,
gonna move my foot
yeah,
just
that's
a-
fine. You
just
can
for a
move.
second.
And then when you're ready, just adjust to the other side, and then I'll do the stitching. And take your time. Always fast, but never hurry. And so the deep suture means that the knot is going to be at the bottom portion of the incision, which means it hides better. And when you do the deep sutures, oftentimes they can close the skin. You may not even need any additional sutures, but I am going to put some additional. So you see how that closes things and brings them together very nicely. The closer you get the skin edges, the better the incision is. Very good. Thank you for watching. Thank you for sharing. I am Dr. Rich Castellano, double board certified facial, plastic, and reconstructive surgeon. Do we have the anatomies? Yes. There we go. And then I'm just reshaping the tragus here. And then thinning out a little bit of the subcutaneous tissue. So that will allow us to have a nice shape for the tragus. Perfect. Everything's looking good. So we tie that down, and as I'm putting the knot down, when I make a stitch and I'll pull it back and forth, it just allows me to get that knot cinched tighter so that it's right where we need it to be. And then we trim right on the knot. Thank you all for watching. Thank you for sharing. Perfect. And then a few stitches from behind the ear. Okay, very good. And this brings the edges together nicely. And then, okay. And the same thing over here. deep stitch comes out, you start below the surface of the skin, you exit through the junction between the dermis and the epidermis, you enter here now through the dermis epidermal junction, and you exit through the subcutaneous tissue and subcutaneous plane. Perfect. And now we do I'll take those. The chromic, can I have the chromics, please? Yep. Perfect. And if I like to trim a little bit more of a stitch or be fussy about things, that's what I like to do. I just want to make sure it's exactly the way that we want it. This is the 5-0 chromic here. Okay. Thank you all for watching. Thanks for sharing. And I'm going to adjust you. That's perfect. Just like that. Won't take that long. Then we're going to shift to the other side, and we will be rebroadcasting. So if you're watching on video, make sure you're following Image Lift on Facebook, following on Instagram now, and following on YouTube so that you can get updates on our future videos. Perfect. I must have thrown over 1 million stitches in my life. You get the hang of it after a few thousand, and I put the stitch probably every 2 to 4 millimeters in distance from one another along the skin incision line. Very good. So when your assistant, for the physicians and residents that are watching, when your assistant knows what you're doing, as soon as I draw up, she can grab the rest of that suture and she's keeping it out of my way. And what happens is that just allows me to move much more efficiently, because if the stitch is in the way, it can create a knot or it slows me down. But this allows me to just move the fastest rate. So Charlene's been working with us for years. She knows, and we work very well together. And that's what, when you have an assistant, it's important to train them that way. So that way you don't even have to speak. You don't have to think. In fact, they'll sometimes do the thinking for you. They'll say, okay, we're doing this next. And they're like, that's right. And of course I approve. She's not controlling, doing all the thinking, but she does a lot of it. And together we make a wonderful team. So
absolutely.
We live in the world of remote control robots. My son has his little RC car that he loves driving around, so we're not to remote control surgeons yet, but I'm sure that's going to come at some point. Okay, so now, thank you all for watching. Thank you for sharing. I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. We're here with Terry. Terry is doing very well. Terry, you're going to love your neck and your jawline. It's such a nice improvement that looks very natural. I normally tell patients we're going for the gold, and Terry wanted to go for the platinum, so we are going to go for the platinum. We'll go for the very best, and can't make it perfect, but it's going to look natural, it's going to look good, and she's going to be happy. Okay. So now this is the pre-lobule area right in front of the ear. We're just past the tragus.
Oh, let me just move my neck.
Yeah, you can move your neck. That's fine. It doesn't bother what I'm doing. As soon as you're done, that's fine. And then I'll just finish the little stitches here. Very good. So I tell patients, be very careful when you're taking shirts off and on, because It can pull on the earlobe, or the lobule as we call it. That's the anatomical term. We always have to have these fancy names for everything. It makes us feel very important. But it does derivate back to Latin and Greek anatomy. So we stand on the shoulders of giants. Everything's looking good. Perfect. Thank you for watching. Thank you for sharing. Perfect. So this is the posterior limb of the facelift incision. Everything's looking good. And then we'll have you can adjust your position here, and we'll have you turn your head to the other side as soon as I'm done stitching here. So thank you all for watching. We're going to be ending the video soon here and then going to the other side. So please do follow, please do share. We are Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. If you're interested in the pricing, you go to imagelift.com/pricing. If you want to know events that we have, imagelift.com/events. And give us a call, 813-463-9245 if you have any additional questions. We only focus on the face and neck. That's why patients come to us, because they want someone who's a center of excellence, someone who just does that thing that they're interested in. It does give you a different level of distinction and understanding. Perfect. And so I'm just stitching this area. So you can see her jawline now, and what a difference. It really looks amazing and powerful. Cut for me, please, and then I'll show you her before pictures. And then we're gonna go over to the other side. Here you go. And so what a wonderful jawline. That's awesome. Yeah, you can adjust your head, and that's fine. And as soon as you're adjusted, I'm gonna have you turn your head back to the other side just a little bit, so you can see her jawline right through there, and chin all the way up. That's perfect. So wonderful jawline, looks amazing. You know, where there was jowl, tight neck. And then let's take a look at her. When you see in her pictures, what a difference. And so congratulations to Terry. We will still be doing the other side, of course, but making great progress and improvement. So we will see you all in the next video. And thank you all for watching. We'll see you in the next video. Whew, you did great.